Hello, Facebook fam, or social media, I shall say. This is nurse practitioner Katina Kennedy back again with some information for you, some valuable health information. October is Breast Cancer Awareness Month, so I decided just to do a quick informational session on your self-breast exam. As women and men, actually, men need to do their breast self-exam as well. But as women, it's very important to do it once a month after your period. Don't do it before, because if you do your breast exam before your period, you will feel some lumps and bumps there. All right, so it's best to do it because of hormonal changes. We do become what they call cystic before our periods and lumpy. Our breasts are lumpier and it's tender as well. So it's recommended that we do our breast exam once a month, about 2 weeks after our period, 1 to 2 weeks after our period. That therefore the hormonal changes are back balanced and so forth. So once a month, you can do it in the shower or you can do it laying down. There are awesome videos on YouTube on how to, do it correctly. But if you do want to do it in the shower, you want to make sure your chest is soapy, and the technique you want to do is just go up and down the breast. Up and down the breast, up and down the breast. And you want to make sure you cover up in this area as well. And then you want to squeeze the nipple for any nipple discharge, because you should not have any nipple discharge either. If your nipples are becoming inverted, meaning cause some people are born with inverted nipples, and that's fine. However, just make sure that that's nothing new. All right, you should not. If you were born with inverted nipples, it's okay. But if that's something that has evolved over years, then you definitely want to get that checked out. So you should not have any nipple discharge. You shouldn't have the inverted nipples if you had not already previously had that. You should not have any lumps. Now a lot of my patients ask me, well, my breasts are lumpy. I feel all these lumps, but that's your breast tissue that you feel. So what's important is that you feel your breast so you can get familiar with how your breasts feel. That way, if you do feel something that's different, you'll be able to identify that. So again, do your breast exam once a month, 2 weeks after your period. Soapy water, that way your hand just glides through your breast. You can just go in the up and down pattern. Make sure you cover the entire breast. If you want the technique, you can go online or YouTube it, or go to the Breast Association and they show you the correct technique on how to do a breast self-exam. But I'm just giving you a brief overview on what you should do. Also, if you're 40 and over, make sure you go get your mammogram done once a year. Sometimes it depends on your gynecologist. They may have changed it to every 2 years, but again, that's up to your healthcare provider. Between the ages of 35 and 39, you should go for a breast cancer screening. All right, and that's just your mammogram, just one time between the ages of 35 to 39, just for a baseline mammogram. All right, so that's just some general information for you. I hope that you learned some type of information here. Don't forget to go on my YouTube page. I have many different videos on various health topics for you available. And pass this video on so that other people can be informed as well. I do this for you. I do this so that you can be knowledgeable on different health topics, so that if you are experiencing any symptoms or things, that you can go ahead and you can contact your healthcare provider and get yourself checked out. So breast self-exam, start doing it once a month. You can save your life if you do this. All right, once a month, start feeling your breast. Don't ignore it. Until next time, talk to you soon.